Perfect, there we are. Well, good evening, members, and welcome back to the evening session of the Public Deputations. My name is Gary Crawford. I'm the chair of the Budget Committee. And the clerk has confirmed that we do have quorum. Today's meeting is being held by video conference, and city staff are also connecting to the meeting via video conference. And as City Hall remains closed, the public will continue to participate electronically and can watch the meeting streaming live on YouTube at youtube.com/Toronto City Council Live. I do ask for everyone's patience if we experience any delays or technical problems during the meeting. There have been one or two so far. And I'd like to remind staff to keep your mics and videos turned off. It'll make it easier for me as the chair to watch those on YouTube and to observe members as they participate in the meeting. Members, please remember to keep your mic muted and your video turned on while we hear public presentations of the budget. And if there's any visiting councillors, I don't see any at the moment. Also have your cameras on, please, so members of the committee and the public will be able to see you, and the clerks will be able to record you in attendance. Members, first thing, declarations of interest under the Municipal Conflict of Interest Act. Are there any? Seeing none. The purpose of this special meeting of the Budget Committee is to hear public speakers on the 2021 capital and operating budgets. We have been doing that today. We've had two sessions so far, in the morning and afternoon. We've been listening to people, and this is the evening opportunity for residents and people to register to speak to the Budget Committee. The clerk has posted the speakers list online at toronto.ca/council. You can click on the speakers button for today's meeting to see a complete list of names. And for everybody who's listening at the moment, process is I'll be calling your name. And you will be unmuted by the clerks, and you will have 5 minutes to speak. I'll give you a bit of a nudge or a nod just before 5 minutes if you need that. And you'll have to wrap up. And then if there's any questions from any councillors, they'll probably indicate that and ask you any questions. And after you've spoken, you can stay connected or listen if you wish. We've also received emails and communications from the public about the 2021 budgets. Those communications are available to members on the CMP or the clerk's meeting portal. So I encourage the public to send their comments to the Budget Committee through the budget process by emailing buc@toronto.ca. We are listening again this evening. We will be listening to public deputations tomorrow. So if you have any opportunity, if it's not tonight, you want to reach us, you can do that tomorrow. We're going to be meeting again on January 28th for our first wrap-up meeting, and then on February 4th before the Budget Committee makes final recommendations that go off to Executive and then to Council in February. Again, I think we are ready to proceed. I will go to the speakers list. Any questions from any members at all? Great. So what I'll do, we have 10 speakers who are registered. I will do the first 3 just so you know when you're coming up. And I'll just mention your name just before you do that. So we have Asiata Han, Mark Anthony, and Scott Miller Berry. So we'll begin with Asata Han. You there? Asata Han. I'll try one more time. Hopefully I'm pronouncing your name correctly. Asata Han. Okay, we'll come back. If Asata's having some challenges, we'll come back to her. Mark Anthony. Mark Anthony Del Bracco, sorry.
Good evening, committee. My name is Mark Anthony, and since June, I have been a frontline shelter worker. I live and work in Ward 13, which has one of the highest volumes of in-crisis calls. Like many essential frontline workers, I've had no paid sick days, no job security, and our pandemic pay ended in August. Though I wish for improved working conditions, my deputation regards the operating budget. Firstly, I don't know why a guiding principle for this budget is to keep property taxes affordable. This favors the wealthy by incentivizing land banking and relieving property owners from contributing more to the operating budget. Instead, I would like the city to keep income taxes affordable, which would benefit Torontonians affected most by this pandemic. My main purpose for speaking here today is to ask City Council to reconcile with Torontonians for the lack of community trust in police, especially Black, Indigenous, and racialized residents. Based on the 2018 action plan to confront anti-Black racism, the city knows this lack of trust means many incidents of harassment and violence go unreported. Based on experiences with police services, care providers like myself are purposefully avoiding calls to 911. The Community Crisis Support Service pilot proposes piloting a new service for some non-emergency calls. This proposal, however, fails to realize that most crises are emergencies, especially for the person experiencing the crisis. Toronto Police's mobile crisis intervention team, in my experience, fails to meet the needs of people in crisis. The MCIT program is not a first responder. It cannot be accessed directly, and nurses arrived dressed like police with armed police in police vehicles, which is confusing for the person in crisis. Recent approaches to crisis response reduce or remove police presence. In my experience, the presence of law enforcement always escalates every situation. The level of authority granted to police places them in a unique position within our current social hierarchy in which they seem to have been given carte blanche. I am doubtful that any amount of training can fix the systemic problem. One measure the city chose to stop over-policing Black Torontonians was to improve officer training to better protect and serve Black people. Police cannot protect or serve a group that does not trust them. When responding to a person in crisis, I have learned through trauma-informed care to de-escalate by collaborating with the individual. I have to share my power with this person in crisis in order for us to make informed decisions together. I must not try to control this person because I need their trust in order to help them. I must not police this person. According to the CCSST, city staff will promote policing alternatives where appropriate, which will reduce the costs of policing. Furthermore, the city knows there is a lack of funding for comprehensive mental health supports. The city must not only advocate to other orders of government for additional support, but also remove systemic barriers in our current system. I am hopeful for a future where police are no longer first responders. I look forward to public education campaigns that introduce Toronto to a new community program in which calling 911 doesn't guarantee police presence, but instead links callers to a network of crisis supports. The city knows that several decades of underinvesting in mental health treatment has meant that more people with mental illness aren't receiving the supports they need and are falling into distress, resulting in increased interactions with police because, inexplicably, police have become default first responders. Thanks to Mayor Tory and Toronto City Council amending the Police Services Act last year, this committee has a unique opportunity to address these imbalances of funding across public services. City Council now have direct oversight over TPS budget, and City Council now have the authority to approve or disapprove specific items in the estimates. In the opening of this year's budget presentation, the city states that trust must be earned through actions and decisions. As such, I am hopeful this committee will decide to redirect their investments into services that can help build a prosperous Toronto. This is the only way I can see City Council beginning to reconcile with Torontonians for the lack of community trust in police, especially Black, Indigenous, and racialized residents. Thank you for this time.
Thank you very much, Mark Anthony. Any questions? Seeing none, next is Scott Miller-Berry. Welcome, Scott. Scott Miller-Berry, are you there? Okay, we'll come back to Scott. Apparently, Asata is having challenges getting on, but we'll wait for her. So the next three are Luca Pavlison, Jamal Myers, and Tomislav Zvoboda. So we'll start with Luca Pavlison.
Thank you very much. Can you guys all hear me?
We can. You got 5 minutes.
Perfect. Thank you very much. Good evening, everyone. My name is Luca Pavlison, and I am a member of the Budget Working Group in the Toronto Youth Cabinet, which is the official youth advisory body of the City of Toronto. Thank you for giving me the time to speak at this committee, and thank you for being here to listen to all of our comments, especially because I've heard some of you have some special circumstances. So thank you very much for your time. In the past few months, Torontonians have been contracting the COVID-19 virus in record numbers, with daily case counts consistently in and above the 2000s. This led to a provincial lockdown, hurting businesses and therefore the people who rely on them. I'm sure that the committee and I can agree that this is a serious issue that hinders the growth of the city and is important to address. Thankfully, it's clear that the committee intends to tackle this issue, with Toronto Public Health receiving a 22.6% increase in funding from the previous year. This increase will do a good job of helping those who contract the virus and enter the healthcare system, but how have we funded to prevent people from entering our hospitals in the first place? This is where I would like to offer some constructive criticism. Being outside is an incredible way to limit the spread of COVID-19 as particles disperse in the air, while also giving Torontonians valuable opportunities to exercise and promote their mental health. As a result, the Toronto Youth Cabinet and I would have expected for the city to set aside more money for funding for these outdoor activities, thus preventing the overflow of our healthcare system by making safe spaces in our great outdoors. What we saw on January 14th was the complete opposite, as parks, forestry, and recreation received a 1.5% cut. Neighborhoods like mine rely on this money to sustain the deteriorating lands surrounding Mimico Creek, but this cut will significantly hinder our abilities to go outside safely. On top of this, the overall city planning budget decreased by 2.3%, which will also hinder our abilities to plan new outdoor initiatives and govern the city in a beneficial way. Even useful outdoor venues such as the Toronto Zoo, which we could use as a method of promoting outdoor activities, had their budget cut by 11%. Imagine if, instead of cutting these services, we promoted them as a safe way to get out of the house. The truth is that this might be a new normal that we have to live with. The COVID-19 pandemic could last for a long time. It could end quickly. We aren't sure. But this is something that we might have to live with for a long time. And having us cooped up in the house is not something that's realistic. So what the Toronto Youth Cabinet and I would propose is that we should give Torontonians the opportunities to better themselves physically and mentally while staying safe at a time where many are locked at home for days on end. Take a second to reflect on this. Why are we funding the healthcare sector to care for those who catch COVID-19 when we could also funnel money into services that prevent people from contracting it in the first place? If we are to tackle this global pandemic as a united city, we must fund for both prevention and illness care, which we are not doing in this current version of the budget. To expand on this idea, I would also like to discuss various initiatives such as Cafe TO and Active TO. Much like the previous ideas I presented, these projects would be very useful in getting Torontonians outside, even as Mayor Tory stated. What was the budget's response to this idea? $22 million supporting various projects such as equity, reconciliation, mobility, and transit, with Active TO and Cafe TO included near the bottom of that list. My question to the councillors is this: how much money is going to Active TO and Cafe TO, and will this amount be enough? Many of last year's investments into Active TO would put a significant dent in this $22 million amount, such as the bike lane project on Brimley Road in Scarborough, which cost $120,000 to install and $80,000 to remove. If we intend to grow this initiative, like the Mayor and the Toronto Youth Cabinet believes we should, many projects of similar cost to this one in Scarborough would be carried out, which would make up a large part of this $22 million. I mean, half of this amount is spent on mere road salts on an average year. A healthy Toronto will not exist with this current investment, and it's important we bring more money towards these outdoor initiatives. I, alongside the rest of Toronto, am looking at all of you to ensure the safety of the city. This COVID-19 virus may last for a long time, and we may have to prepare for a budget which accounts for this. Locking people in their homes without any outdoor initiatives is not sustainable, and we must promote these activities through our financial allocations. This current plan will not do this. It won't stop people from getting sick, but will instead support them once they contract the virus. We have to invest more money into initiatives that will stop the spread at its source, such as Active TO and Cafe TO, as well as funding services that will make Toronto's great outdoors an appealing area for those who need safe spaces to get exercise. I have hoped that the city can be as prosperous as ever during the pandemic if we can simply make our citizens happy and healthy. Thank you very much for your time.
Very much. Questions? Great. Thank you very much for your presentation. Next, we have Jamal Myers. Jamal, you there? Jamal Myers. One more call out. If you are having challenges connecting. Jamal, just try again if you can't speak. Tomislav Svoboda. Tomislav Svoboda. Okay, so we'll come back to those. Jessia Smith. Jessia Smith. And I believe Minaskshi Das is also having some challenges. I don't know if she's connected. Minakshi Das. Okay, next, Dr. Diane Sachs. Dr. Diane Sachs.
Yes, I'm here.
Welcome.
Can you hear me?
We can hear you. You have 5 minutes.
Well, thank you very much for making time for me tonight and for allowing the public to participate electronically. I'm here primarily, I should introduce myself. I'm a resident of Ward 11. I was the Environmental Commissioner of Ontario, and I'm now the Deputy Leader of the Ontario Green Party. I'm calling primarily to endorse the 6 recommendations that the Toronto Environmental Alliance has already submitted to you. It's wonderful to see the stated priorities for the budget: equity, health, and well-being, and climate action, but they're not borne out in the spending decisions, and in particular in the revenue decisions as well. Starting with item number 1, the underfunding of the Environment and Energy Division. As you all know, the climate crisis has many aspects, and it's bearing down on us faster and faster, whether or not we're in a pandemic. The pandemic has given us a taste of the kind of punishment that climate will bring, but the pandemic will end and the climate crisis won't. So we really have to be getting ready for it. And underfunding the Environment and Energy Division means that they don't have the staff and can't keep the staff to prepare the plans that could then come back to you for approval. If the plans aren't ready, they won't be funded. If the plans aren't funded, they won't be implemented. If the plans aren't made, funded, and implemented, we're not going to be ready as the climate crisis bears down on us. The net zero emission strategy, the climate lens on city spending decisions, the low carbon job strategy, the dedicated climate action fund, they're all late already and will be much, much later if the division continues to be so underfunded. Their second point was about prioritizing investments that enhance health, equity, and climate action. And all I want to add there is that when a city is in financial difficulty, as we all know the City of Toronto is, the investments in active transportation are the cheapest way to move people around, and they produce better health, and they produce better air quality, so they provide multiple paybacks. Putting money in ways that allow people to get around healthily and independently will pay back for the city for a very long time, and there are things we can do on a budget. Finally, I want to echo the voices on point 4 of the Toronto Environmental Alliance list that prioritizing low property taxes for homeowners isn't the way to go. We know that the pandemic has increased and exacerbated inequality. We know that the climate crisis will also make inequality worse. The most vulnerable will suffer the most. And minimizing property taxes for homeowners does the same thing. People with large houses, wealthy, valuable houses, they save the most, and the people who need city services the most suffer the most. So I would urge you instead, increase the property tax, provide the money that you need to do the various things the city needs, and provide targeted relief to those who need it. We have an increasing division in the city. Many people are suffering financially for sure, but many others are not suffering and in fact have more money in their pocket because they haven't been able to go out and spending it. And keeping the city on a starvation budget doesn't achieve the public goods that we all need. Second thing I wanted to say to the committee, just to remind all the councillors, is that Climate Act. So I put together at the request of some councillors a committee of the leading sustainability professionals in the 4 Toronto universities and presented their reports to council in October. And we're still waiting to hear back from council, any response to our recommendations, whether any further work by the committee is desired. This is all work that we all did at our own expense off the corners of our desk in order to be of assistance to council. I think all the members are still willing to do some of that work if the councillors actually would like us to and would find it helpful. Finally, I would like to remind you that a number of the recommendations that we made through the Climate Act were for ways for the city to do more with less, and that, again, particularly in a time of a limited budget, might warrant some attention. So unless anyone has any questions, thank you for your time and attention, and good luck with the baby.
Thank you very much. Any questions? Great. The next is Chris Chandler.
Good evening,
Chris.
councillors.
Good evening, Chris.
My name is Chris Chandler, and I live in Ward 9. I'm a public high school teacher by trade. I currently work for the Toronto local of the Ontario Secondary School Teachers Federation. But I have spent 18 years in Toronto District School Board classrooms with this city's youth at 4 different schools, and I work with teachers who support Toronto's students every day. I use transit myself heavily, as does my partner and our 2 children, since we don't own a car. So it's really for those people in our schools that I'm here today to ask you to consider one critical way that Toronto's public dollars can be spent justly, both in the public interest, but also within the context of COVID-19 and of public safety in a pandemic. And what I'd like to ask is that you prioritize public transit in this budget more than ever before, mindful of the $185 million projected shortfall. But if you look carefully into the daily lives of many education workers and into a very large number of secondary students, you'll learn that quality public education is deeply tied to quality public transit. One depends really on the other. These 2 critical forms of infrastructure are intertwined, since many education workers and a very many students depend upon the safe, timely, and frequent service of the TTC to get them to and from our schools, which serve as the crucibles not only of young people's dreams, but of a civil society itself. Who knows when the Ministry of Education will lift this city's current school lockdown, and what risks will be there facing students when they do. So I ask that you imagine what it's like for a public school student whose educational program of choice is far from their home in this great city, waiting at a TTC bus stop on their way to school. They are worried about COVID-19, obviously. They don't want to be late, perhaps for a specialized school program they love, or simply for a favorite class. They want to be on time, but they also want to socially distance on the only vehicle they can ride to school. The bus that arrives for that student should not be crowded, ever, of course, but now especially. Not if you want to keep them from waiting for another bus, to keep them from choosing between being late and guarding their own health, or the health of their family, or their community. This is not a choice that young people should be given. You do not want that student to be unsafe in crowded transit later, to an after-school job as they build our economy, or save for post-secondary education, to become a contributing citizen, to help us pull away from COVID-19 and build the Toronto we all want to live in. So to put a fine point on it, the current TTC plan to increase the crowding standard from 25 to 35 people is unacceptable. So I ask that you think of our education workers and our students when you decide on Toronto's budget, where you'll get the money, and what you think our students and education workers deserve in a transit system during a pandemic and beyond. I ask that you see the TTC not only as a lifeblood for citizens, workers, seniors, and families. I ask also that you prioritize in the budget for the TTC the highest possible service levels, the least amount of crowding, and the lowest possible fares, because you believe that quality public education, the health of our children, and the city's future depend on it. Thank you.
Thank you very much, Chris. Questions? Thank you for your deputation. I'm going to go back. There's a few names that have come back on, so I'm just going to go through the list one more time. Asata Han, are you there? I don't think she was there. I believe Scott Miller Barry is now connected. Scott, are you there?
Good evening. Hello.
Great. Welcome.
Welcome. Thanks for your patience with me. Good evening, committee and councillors. Hope you and yours are keeping well. Thanks for the time tonight. My name is Scott Miller Barry. I'm a homeowner in Ward 4 near Jane and Dundas, proud Parkdale High Park resident since 2002, both in the previous ward and again in the glamorous expanded number 4. By day, I'm managing director at Workman Arts, which is an arts and mental health organization in Toronto's West End since 1987. Our charitable organization is the oldest arts and mental health organization in Canada, and we currently service over 475 artists with lived experience of mental health and/or addictions. Our mission is to reduce social isolation, which I'm sure you know is one of the prime predictors for poor mental health, through engaging artists in free weekly art classes, workshops, presentation opportunities, including our annual Rendezvous with Madness festival. As you can imagine, it's been a challenge, like with everything, but our modest team has worked tirelessly to move and deliver classes online, even by mail or delivering at-home class kits. An overwhelming number of our members tell us they're greatly impacted by the increased isolation during COVID-19 and the increased financial precarity, as the majority of these folks are on fixed incomes, which is not a requirement for our free programs and membership, by the way. Many are now feeling detriments to their well-being that comes with isolation, and the truth is that a high proportion of our community has been experiencing these detriments for a very long time. Workman Arts does our best to fill the gaps by offering peer support through phone, text, email, and video. We're very much constrained by our resources, offering just 25 hours per week on these supports at the moment. My insights at Workman Arts and my own mental health struggles offer inspirations to my plea to you tonight in terms of the 2021 budget. I'm here speaking on my own behalf as a resident. I believe the 2021 budget offers a great opportunity in light of the drastic overall situation to do things differently and to try and meet the needs of all residents. I'm here tonight to impress upon you my very biased opinion on the budget task before you. We all know mental health challenges intersect with and are the products of systems of oppression, such as racism, sexism, and ableism, among others. Now's the time for considerate interventions, in my humble opinion. As the city plans for an equitable recovery, one line item in the budget stands out and requires an immediate change, and that's the Toronto Police Services. There's an unacceptable level of policing in the city. I've also seen while numerous supports and services at the community level are underfunded, the TPS is continually overfunded. Even a 0% increase to the TPS would still mean an overfunding, and at this moment, I believe we desperately need a reduction in TPS funding and a reallocation of these funds to community programs and services. Across Canada from 2000 to 2017, CBC News investigation found that 70% of folks who die in police encounters struggle with mental health issues, substance use, and/or both. The 2018 Ontario Human Rights Commission found that a Black person is nearly 20 times more likely than a white person to be involved in a fatal shooting by Toronto police, to say nothing of Indigenous and other racialized residents. I'd like to quickly remind you of the case of Charles McGillivray. He was walking with his mother on Bloor and Christie when police mistook him for another individual and ended his life. Charlie, who was affectionately known as Charlie or Lurch, was differently abled cognitively, including not being able to verbally speak. Charlie's on a long list of Torontonians such as Andrew Loku, Coco, Regis Korchinski-Paquette, Sami Yatim, and many others. These are Torontonians who are different, whether racialized, living with mental health and/or addictions, situations, differently abled, and the more likely to suffer violence at the hands of an overfunded police force. The TPS is the single largest expense item in Toronto's budget. You have an incredible opportunity once again, and I'd like you to imagine reallocating some of this money on community initiatives such as secure long-term affordable housing, overdose response and harm reduction, food security programs, public transit, public libraries, supports for survivors of gender-based violence, and perhaps most importantly, from my personal vantage point, and this would be excuse me, I lost my place, community-based crisis response models. As a homeowner in Ward 4, I kindly urge you to put forward a budget that meets the true community health and well-being of all residents, and that requires more than just a 0% increase for the police. I might add, as a homeowner, I'm humbly in favor of raising property taxes and bringing back the vehicle registration tax. I support Black Lives Matter Toronto's demands to defund the TPS by at least 50% and to move these into community programs and supports. I humbly ask you consider my deputation and the budget you put forward. Thank you again for your time.
Thank you very much. Okay, seeing none. I believe Jamal Myers from Toronto Scarborough Transit Action is now connected. Jamal, you there?
Hi, yes, I'm here.
Okay, you're up.
Great, thank you. Good evening, members of the Toronto Budget Committee. Thank you for the opportunity to speak with you today. My name is Jamal Myers, and I'm a Ward 24 resident and an organizer with Scarborough Transit Action, a grassroots transit advocacy group that advocates for better transit for Scarborough's transit users. Because of the pandemic, many Scarborough residents lost their jobs while many others now work from home. For those working from home, it is highly likely that at least some of them will continue to do so once the pandemic is over and will thereby take fewer TTC trips in the future. For those that lost their jobs, they too will have fewer reasons to take the TTC. Given that 97% of the TTC's non-subsidy operating revenue is from passenger fares, even a drop of 5% in daily commutes will have a significant impact on the TTC's budget over the long term. Conversely, while a significant amount of Scarborough's transit users are expected to ride the TTC less for the foreseeable future, many others continue to endure long commutes on overcrowded and unsafe buses. These riders are disproportionately women, seniors, racialized, and low income, and rely on the TTC to get to work, buy essential goods and services, and see their doctors. As Scarborough emerges as a, quote, ground zero for COVID-19 Ontario, end quote, these riders are at a disproportionate risk of getting infected from a variety of factors, such as the type of work they do and the home they live in. Riding the TTC should not be one of them. For this reason, Scarborough Transit Action is against the TTC's budget plan to increase crowding standards on buses from 25 to 35 people per bus. With buses having recovered approximately 48% of their pre-pandemic ridership activity, increased crowding levels in a COVID hotspot like Scarborough puts the health and safety of riders at risk and further fuels the high levels of stress and anxiety bus drivers are facing. Rather, we propose that the savings garnered from reducing streetcar and subway services, as proposed in the TTC budget, should instead be reinvested into additional bus services to keep crowding levels at 25 people per bus. For Scarborough, these additional buses will be required for the expected shuttle bus replacement for the Scarborough RT, which the city has now confirmed will be decommissioned prior to the city's preferred subway replacement being built. The current budget makes no provision for this planning, which in addition to more buses requires creating a dedicated right-of-way and signal prioritization. We recognize that the purchase of the buses must contend with the TTC's limited storage capacity and lower revenues from TTC fares. Scarborough Transit Action therefore strongly encourages the city to set aside money in the budget to allow Scarborough Transit users to use GO train services at no extra cost. If Scarborough Transit users could pay a flat fee TTC fare to use TTC buses to connect to GO trains within Scarborough, this would help alleviate pressure on any replacement shuttle service. Finally, in order to provide Scarborough residents with more safe mobility options, we strongly urge the city to keep the bike lanes on Brimley Road, which is the easiest thing to do because it requires the city to do nothing. Toronto spent $160,000 installing them in this summer and now wants to spend $80,000 taking them down. Decisions like this show the disconnect between councillors and their constituents. In addition to being an organizer with Scarborough Transit Action, I'm a board member of Untitled Community Health Centre in Malvern, which is focused on serving the health needs of Black residents, and the Scarborough Business Association, the voice of Scarborough's businesses. All three of these organizations have worked on the front line to help Scarborough residents meet the challenges of COVID. However, in all of the challenges I face sitting around these boardrooms, working within these organizations, getting rid of bike lanes has not been one of them. For cities facing financial challenges brought on by the COVID pandemic, moves like this increase the cynicism of Scarborough residents feel when the city constantly tells residents it does not have money for residents' transit priorities like fully funding the low-income fare pass, but easily finds money to increase the convenience of drivers. These decisions need to end. Thank you.
Thank you. Are there questions? Seeing none, the last speaker tonight will be Tomislav Zavoda. Tomislav, are you, I think you're connected now? Tomislav. I know he was having some challenges connecting. Apparently I thought the clerk said he was connected. I'll try one more time. Tomislav Zavoda. If you are listening, Tomislav, and you can't connect, maybe if you can send in a written submission to us. Oh, hold on. Is that Tomislav? Yeah, so if you can hear us, just send in if you can send in a written submission, we'll definitely read it for you. Colleagues, I think that was it. There were a few people who never did log on the list, so that was the last of the deputations. So I'll need a motion to receive the public presentations. Councillor Bradford will move that. All in favor? Opposed? That's carried. Well, we are done. We'll see everybody tomorrow, and we'll see what happens. Best of luck tonight, Brad, and whenever that moment.